G'day guys, Dr. James here with another vet tip. This video is part 2. I'm following on from a video, my dog has diarrhea, should I go to the vet? In this video, I'll cover what the vet is likely to do in a consultation, what treatments or tests they may recommend, some tips for patients with recurring diarrhea, and I'm also going to discuss some treatments that you can potentially try at home. So when you get to the vet, things are either going to go one of two ways. If your dog is critically ill, like if they're collapsed or they're having trouble breathing, they're going to be seen immediately and they're going to be treated as an emergency. However, if your pet's doing reasonably well, they're fairly stable, then you're likely to have a consultation with a vet. So what happens in the consult? Well, most vets are going to want to take a physical exam and a medical history. A full physical exam is where we basically check your dog over from nose to tail. And when we're thinking about diarrhea as the concern, that's going to mean we pay special attention to a couple of areas. Things like we're going to very carefully feel the abdomen, see if we can feel anything abnormal or any signs of discomfort. We want to assess for signs of dehydration, which can be done by checking the gums. We're looking for moisture, we're looking at the colour. We're going to check something called capillary refill time. We're also going to assess the skin, eyes and pulses as other ways of gathering information about dehydration. We're going to want to check out your dog's demeanour, their basic neurological function. We'll take a rectal temperature and often we're going to feel their superficial lymph nodes as well as performing a rectal exam. We're also going to want to know the medical history in detail, and that will help us understand possible causes and appropriate treatments. There's a lot of questions there. We're going to want to know about the size of the stools, the frequency, whether there is straining, whether your dog is up to date with worming, their vaccination history, and we're going to try and get through a lot of this in one consult. So to try and keep costs down and be as efficient as possible, it's helpful if you have had a good think about these questions before you arrive. You know, sometimes it's the case that like a couple comes in and, you know, they don't know the specific details. They're sort of going like, oh, well, on Saturday we had lunch and then maybe in the afternoon was the first one, but then, I don't know, we went for a walk and do you remember when the last or the first diarrhea was? And this can really take up a lot of time and that time is very, very valuable. So knowing that the answers to those questions before you come in gets you the best chance of getting an answer quickly. The other thing is to make sure the person is coming in actually knows the answers to those questions. Sometimes people get a relative to bring the dog in and you know that's really important if you can't get into the clinic yourself, but make sure that they either know what's going on or that you're available to talk on the phone because if we can't get a detailed medical history, it means it's much harder to treat, and so we may need to rely more on testing, and testing obviously, you know, takes time and money. So being well informed on that stuff is really, really helpful. What treatment or testing might the vet recommend? Well, sometimes diarrhea can be treated at home, and if there's someone who can keep a close eye on the pet and follow some, you know, basic diet instructions for the next couple of days, that may work. Sometimes some basic medications can be used at home, which will relieve symptoms and speed up recovery. And this approach will be common if we haven't found anything really concerning on the physical exam or in the medical history. I'd love to say when you bring your dog to the vet that we can guarantee we're going to stop the diarrhea straight away. But it's worth noting, unfortunately, we don't have very safe and effective medications that just completely stop the diarrhea. I mean, with humans, there's medications like GastroStop, but these are not often recommended for dogs. They're not always safe or appropriate. So we can usually make the diarrhea go away faster, right? And hopefully make the pets a bit more comfortable, but a sudden stop is not always on the cards. In the past, vets used to frequently dispense an antibiotic, something called metronidazole or Flagyl. This isn't really recommended as a first-line treatment anymore. We're just much more cautious with antibiotics now than we were in the past, because we know that the antibiotics can disturb a pet's healthy gut bacteria, and also that antibiotics increase the chance of developing an antibiotic-resistant infection. Now, they're really nasty in pets and also potentially transmissible to people. If the vet is worried about your pet, their condition now and over the next 24 to 48 hours, they may recommend doing some tests. So this can include blood testing, urine testing, sometimes they'll do some fecal testing. In some cases, trying to get a look at what's going on in the abdomen is important. So for that, we would use x-rays or an ultrasound or both. Nobody wants unnecessary tests, right? Good vets will not recommend diagnostic testing unless they believe that it's going to help your pet stay safe and recover more quickly. You know, we're just not in the business of offering tests for the sake of it. And one way to reduce the chance of needing expensive tests is if we see your pet earlier in the disease process, you know, day 1 or 2 rather than day 3, 4, 5. If the vet recommends keeping your pet in hospital, it's usually for ongoing treatments such as IV fluids in a drip, or sometimes injectable medications, things that we can't give you to give at home. So what if my dog has recurring diarrhea? Well, if your dog has recurring bouts of diarrhea, these cases can be complicated. And it can be complicated because there's lots of potential different causes and many available treatments. The right choice is going to depend on carefully weighing many factors. A dog with diarrhea is a bit like a car that's just not driving right. You sort of know something's wrong, but the mechanic can't just guess the problem. They're going to have a good look under the hood, right? And possibly run some tests. Same with vets. So to find a solution as efficiently as possible, one thing you can do is try and see the same vet each time you go to the clinic. You might be able to request that vet by name, or when you book with reception, you can get them to look up who you saw last time. Having that continuity of care with the same vet will save you time and money and get you the best outcome for your pet. The exception to this is if you don't think the vet you're seeing right now is right for you or for your pet. You know, and if that's the case, definitely seek a second opinion. That could be with another clinician at the same clinic or from another clinic. So one common cause of diarrhea is due to sensitivities to certain things in the diet. Dogs might have sort of mild sensitivities, or they can have more severe reactions to food, or even worse again, dogs can have full-blown irritable bowel syndrome, right? Now these disease processes are not perfectly discrete. They sort of exist on a spectrum. The symptoms and the treatments are gonna overlap. Your vet can help you identify the true cause and then the most effective treatment, and that's important. Other possible causes of recurrent diarrhea, there's things like hormonal diseases like Addison's disease. There may be complications with your pet's anatomy, could be parasites, and there's a variety of other nasty diseases like cancer. So we can differentiate these causes by doing testing and sometimes also by doing very specific dietary trials. Right? Now, trialing different diets, it might have to do with the amount of fiber in the diet, it might have to do with the protein source. There's a few different things that we can do, but it's not a simple process. It really requires veterinary guidance. It's very tempting to sort of try and do this on your own by just going to the pet store and buying certain foods with labels that say, you know, sensitive on the guts, or, you know, it's free from this or that. But honestly, that's unlikely to be successful, and people can spend months and lots of money on diets that are not exactly the right thing for them. So I'd recommend getting veterinary help if you've got recurrent diarrhea, because it's probably going to save you a lot of time and money in the long run. Very complicated cases will sometimes need to see a veterinary specialist, and you know, if your pet's in this category, your local clinician will be able to advise you on that. Here's a word about veterinary costs. So veterinary care can be very expensive. You know, good training, high-tech equipment, and the medications, they all cost a lot to the clinic, and the cost of the clients have to cover these costs, or the vets are going to go out of business. One way we can try and make things cheaper is, you know, the earlier we see pets, the more information we gather, and they're less likely to be severe and need, you know, these significant interventions. So even if they're not, critically ill right now, it can still be worthwhile in the long term going to see the vet, because that physical exam, and then if they're still ill later, another physical exam and history is going to give us 2 points of comparison, right? We can understand the progression of the disease and the symptoms, and that's going to give us a lot of clues about appropriate treatment or what the potential causes are. And sometimes that will save having a very ill patient that then needs a lot of diagnostic testing and treatments done in a short period of time, the latter case being much more expensive and more invasive and more unpleasant. So, if cost it's not going to totally break the bank to get to the clinic, if that's the case, it's better to see a vet earlier rather than later, even from a financial point of view. Let's talk a little bit about what you can try at home. So if it's been less than 48 hours and your pet seems fairly well and doesn't have any of the other symptoms that we were discussing earlier, then you could try feeding small, frequent meals of something that's really gentle on the gut, some bland diet. So something like cooked lean meat and boiled rice is great, and just make sure you avoid fatty foods and treats. Also, ensure your pet is up to date with worming. Gastrointestinal worms can cause diarrhea, and they're really easily treated or prevented with some worming chews or tablets. If your dog gets very mild diarrhea from time to time, you can increase the fiber in their diet, and that can sometimes help. So easy ways to do that would be including some cooked veggies like boiled sweet potato or pumpkin. Now, I hope this video has helped you. I'm Dr. James. Please like the video and subscribe if you'd like to get more vet tips.